common hepatic, left gastric, splenic, superior mesenteric, inferior mesenteric, gonadal vein, gonadal artery, then the common iliac arteries and veins, and then these are the pubic veins and arteries. You see that?
Interior.
Internal iliac?
Yeah, internal iliac.
Internal iliac, sorry. Internal iliac artery and vein. That's because on the flat man they named it pubic, so that's how I remembered it.
But it's the same. Okay, over here.
External iliac over on the sides. So internal, external.
No.
Common, internal, and external over on the sides.
Okay, and then the renal.
So the renal artery, renal vein, suprarenal vein, suprarenal artery. And down here. Okay, so the medial circumflex, the great saphenous, the lateral circumflex, the femoral vein, and then this over here are the arteries. So the femoral artery, the medial circumflex, and the lateral circumflex, lymphatic vessels, and lymph nodes. And that's it.
Subclavian vein continues down to
Subclavian.
Cephalic.
axillary.
And then axillary down there.
Axillary. Go.
External jugular vein, carotid artery again, and the other external jugular vein. Then you have the subclavian vein, that's the left subclavian vein, and the right subclavian vein.
This one
And
internal.
then you have the internal what?
Jugular.
Oh, the internal jugular, right. Then you have the aortic arch, that's what they call this one, or the aorta, same thing. Then you have the thoracic aorta, descending thoracic aorta. And then you're going to come down to the cephalic trunk. The cephalic trunk. Celiac trunk. And then to the abdominal trunk. And you have the mesenteric, the superior mesenteric, the inferior mesenteric, the gonadal vein and the gonadal artery, the common iliac artery and vein. Then you have the internal common artery and vein. And then you have the internal iliac artery and vein. And then you have the external iliac artery and vein on both sides.
And lumbar.
And then you take this and you have the lumbar artery and vein. Okay. And then you have the suprarenal vein. And then this little tiny one here is the suprarenal artery. And then branching off from that is the renal artery and the renal vein. Then, what is that? Oh, the spleen. And that's it.
The what?
Do we have the
Splenic?
There's something else in there.
Okay, this one.
It's the same thing. I did it over here.
That's the same thing, the
gonadal.
splenic artery.
Oh, okay, yeah, splenic.
The gonadal.
Oh, I did that.
Yeah, you did this side. Yeah.
Okay, so then it's the gonadal over here, and that's it.
Ready?
Going
And go.
down. So the red artery going down is the vertebral artery, and it comes all the way down the vertebrae. The anterior
Let's
cerebral.
go. Okay, basilar artery. This is.
Oh,
in
I'm
the
sorry.
middle.
I forgot about the basilar artery. Okay. So this one is the basilar artery, the middle one,
Okay, the basal.
the big one.
Okay. Basilar.
Yeah.
Yeah, basilar. Sorry.
I got it.
And then the anterior cerebral artery.
I'm sorry.
This is the anterior cerebral artery. So it's gonna be this one and that one.
It's under.
Yeah. This and this, not this, just these two.
Okay.
Okay.
By the brainstem.
Yeah. And then the posterior cerebral artery is this one. This one here. And then the posterior communicating artery are these here.
Oh. By the eye?
Yeah, so this is the posterior cerebral artery, and then these two that branch off are the posterior communicating artery. And then these are the internal carotid artery, right under the optic nerves, the internal carotid arteries. And you can also see them here, the bulbs of them, just the end of them, not the whole thing, just the ends, because they would sit on top of it.
That's good to know.
And then, yeah.
The middle.
And then the middle cerebral artery is this one, the one I was saying goes in a circle, so it curves around here and it curves around there.
That's the middle.
Yeah. And the vertebral arteries are these down here. These two that branch off from the base of the
down,
artery.
to
And
the spine.
remember you can see it on the back of the new model. It comes from the head and it goes down the vertebrae. And that's it for the brain.
Can you say again?
Which one we will need? Internal, right?